The plan over the next 6 weeks of the semester has been to spend time reviewing the major muscles of the body and understand their specific location, attachments, and movements. We will begin with the major trunk muscles, then move on to the shoulder and upper extremity, and end with the hip and lower extremity. Since the next 3 weeks will be in an online format, I will be developing online videos for you to review on the muscles related to these areas. Hopefully, we will be back on campus beginning Tuesday, April 14th, and spend the final 3 weeks of the semester studying the muscles in the cadaver lab. Listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. These will again be displayed at the end of the unit for your review. The erector spinae group of back muscles consists of the spinalis muscles, made up of the cervical and thoracic components, the longissimus muscles, made up of the skull, cervical, and thoracic components, and the iliocostalis group, made up of the cervical, thoracic, and lumbar components. This graphic better illustrates the 3 types of muscles which make up the erector spinae group. The erector spinae group as a whole assists in laterally flexing and extending the vertebral column. The origin of the erector spinae group is the posterior sacrum, iliac crest of the sacrum, and the spinous processes of the lumbar vertebrae and last 2 thoracic vertebrae. The insertion of the erector spinae group includes the posterior ribs, spinous and transverse processes of thoracic and cervical vertebrae, and the mastoid process of the skull behind the ear. The transversal spinalis group includes the multifidi, rotatories, and semispinalis muscles, as shown in this graphic. This graphic better illustrates the 3 muscles which make up the transversal spinalis group. The actions of the multifidi help to rotate the vertebral column to the opposite side and also assist in extension of the spine. This muscle originates on the sacrum and transverse processes of the entire spine. It inserts on the spinous processes of the vertebrae 2 to 4 vertebrae above their origin. The rotatories muscles are deep to the multifidi and also assist in rotating the vertebral column to the opposite side and in extension of the spine. They originate on the transverse process throughout the spine and insert on the spinous processes of the vertebrae 1 to 2 segments above them, rather than 2 to 4 segments higher for the multifidi. The final member of the transversal spinalis group is the semispinalis, which acts to extend the vertebral column and head. The semispinalis muscle originates on the transverse processes of the thoracic and lower cervical vertebrae. It inserts on the spinous processes of the upper thoracic and cervical vertebrae, as well as at the base of the skull, or occiput. The quadratus lumborum is a muscle in the very low back, as shown in this graphic. The quadratus lumborum assists in laterally tilting the pelvis and flexing the vertebral column to the same side, and also in extending the lower vertebral column when both sides of the muscle are active. This muscle originates on the posterior iliac crest and inserts on the last rib and transverse processes of the 1st through 4th lumbar vertebrae. This muscle is often referred to as the hip hiker muscle, as it is often used by stroke patients to lift the hip up on the affected side in order to raise the foot of the affected leg off the ground during walking. This graphic uses taping to illustrate the position of the 4 major abdominal muscles, which include the external oblique, internal oblique, rectus abdominis, and transverse abdominis muscles. This graphic better illustrates these muscles within the abdominal cavity. The external oblique muscle assists in lateral flexion, rotation, and forward flexion of the vertebral column, and also assists in compressing the abdomen. This muscle originates on the lower 8 ribs and inserts on the abdominal aponeurosis, which is a thin sheet-like tendon in the center of the abdomen. The internal oblique also assists in the lateral flexion, rotation, and forward flexion of the spine while assisting to compress the abdomen. It originates on the inguinal ligament, iliac crest of the pelvis, and the sheet-like tendon of the lower back called the thoracolumbar aponeurosis. This muscle inserts on the lower 3 ribs and the abdominal aponeurosis, which is a thin sheet-like tendon in the center of the abdomen. The rectus abdominis acts to flex the vertebral column. Athletes often do sit-ups to strengthen this muscle group. This muscle originates on the top of the pubis of the pelvis and inserts on the 5th, 6th, and 7th rib and the xiphoid process at the bottom of the sternum. The transverse abdominis muscle's main function is to compress the abdominal contents. It originates on the inguinal ligament, iliac crest, thoracolumbar aponeurosis, and lower 6 ribs. It inserts on the abdominal aponeurosis. This slide discusses neck strain as a common problem of the trunk. Please pause the video to take time to review this information. This slide discusses upper back pain as a common problem of the trunk. Please pause the video to take time to review this information. This slide discusses low back pain, which is the most common problem of the trunk. Please pause the video to take time to review this information. As at the beginning of the presentation, listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. It is suggested that you should begin to study for a test on these muscles by using study cards with the name of the muscle written on one side and the actions and attachments of the muscle on the other side.